Capillary blood sampling is occurring more regularly in healthcare settings as an alternative to venous blood collection. Let's take a look at the sampling procedure in adults and children based on global guidelines and the recommendations of key opinion leaders. As with all clinical procedures, always use your professional judgment and take account of your national, regional, and institutional guidelines. First, start by consulting your institution's guidelines for the type of test you are performing. Consider the amount of blood you need to collect and gather the equipment you will need. This equipment may include gloves, alcohol pads, gauze, safety lancets, a bandage, test strips, a pipette or other capillary blood collection tubes, and a biohazard sharps container. Ensure you are aware of any labelling requirements for blood collection tubes. Select an appropriate single-use safety lancet. The safety lancet should be selected by considering the age of the patient and the type of test being performed. Safety lancets come in a variety of needle lengths and gauges, which provide a depth and size of incision that is safe and causes minimal discomfort for the patient. The colours of the lancet device are often specific to needle size and incision depth. When finger sampling, the maximum needle penetration depth recommended for adults and children over 8 years old is 2.2 millimeters. For children between 6 months and 8 years old who are walking, the maximum recommended needle penetration depth for finger sampling is 1.5 millimeters. Babies under 6 months old, weighing less than 10 kilograms or not yet walking, should be sampled on the medial or lateral plantar surface of the heel, rather than the finger. Tests that require a larger volume of blood will need a safety lancet with a smaller gauge and longer needle length, provided the length remains appropriate for the age and weight of the patient. When performing multiple tests on capillary blood collected during the same procedure, it is important to maintain the correct order of sampling, otherwise known as the order of draw. Maintaining the correct order of draw can help to prevent inaccurate results. Each collection tube cap is coloured to indicate the type of additive inside. This in turn corresponds to the type of test or tests for which it is intended. These colours are universally consistent. The additive chemicals are designed to ensure that the blood is in the state specifically needed for testing. The additive or chemical inside each tube may cause the blood to clot or prevent it from clotting, depending on the need for testing. The lavender collection tube is used for hematology specimens, such as complete blood counts or hematocrits. This type of tube contains an additive formulated to prevent blood from clotting. The green, red and gold collection tubes are mostly used to test blood chemistry, which includes blood glucose, sodium, potassium and other electrolyte tests. The green tubes contain additives formulated to prevent blood clotting, while red and gold tubes will allow the blood to clot. Maintaining the correct order of draw by cap colour is therefore essential. Depending on which tests are being carried out, you may not need to use every coloured collection tube. You may, for example, only need to use the pink, lavender and light green tubes, or you may need to use 3 red tubes. The most important thing to remember is that wherever you start with the cap colours, you must follow the correct colour order from that point on. There are specific recommendations to help you locate a suitable finger sampling site. Choose the sides of the ball of the middle or ring finger. Before sampling, ensure that you have the correct equipment for the tests you will perform. For multiple tests, consider the order of sample collection. Identify the patient. This generally requires asking a minimum of 2 questions, such as name, date of birth and address. Consider warming the sample site to increase blood flow to the area. This may be useful when a large volume of blood is needed or when the puncture area is cold or circulation is poor. Ask the patient to warm their hands by rubbing them together or wash them with lukewarm water. Alternatively, consider covering the puncture site with a warm, moist towel or other warming device at a temperature of 42 degrees centigrade, 107 degrees Fahrenheit or less. Be careful to avoid burning the patient. Disinfect the sampling site using the method recommended by your local guidelines. Allow the area to air dry. If you're using alcohol to disinfect, make sure the alcohol has fully air-dried before performing the procedure, as alcohol can cause inaccurate results by hemolyzing the specimen. Press the safety lancet against the sample site. There are many types of safety lancets available. Some activate when pressure is applied to the sampling site, and others are activated with a button or trigger. Regardless of the activation method, all safety lancets are designed to pierce the skin swiftly and automatically retract into the unit to prevent reuse or needle stick injury. Once used, dispose of the safety lancet in a biohazard sharps container. The colour of the sharps container will depend on your local region's guidelines. The used device must not be disposed of in regular waste containers. After you have made the incision, wipe away the first drop of blood with a clean gauze pad. This will help to avoid specimen dilution with interstitial fluid, which can lead to inaccurate test results. Some tests do not require this step, so check your institution's guidelines for the specific test for which the sample is being collected. Make sure the finger is positioned downwards so that gravity can assist with blood flow. Hold the finger firmly near the base and gently massage along the length of the finger towards the tip, using a gentle squeeze and release technique. This will give the capillary time to refill and facilitate a constant and steady flow of blood. Be careful not to squeeze too hard, as excessive squeezing can cause problems, for example, hemolysis, dilution of the specimen, and obstruction of blood flow. Depending on the test you are conducting, you could use a number of methods to collect the blood sample. If you are using a capillary tube or pipette, hold the device at a 90-degree angle in a horizontal position and touch the end of the tube or pipette to the drop of blood. Avoid touching the patient's skin with the capillary tube or pipette, as this could introduce skin cells into the sample. It is also important not to use a scraping or scooping motion, as this could cause hemolysis or specimen dilution and lead to inaccurate test results. Alternatively, you may need to collect the sample in a specially designed collection tube by allowing blood droplets to drip and flow into the tube by natural capillary action. It is also important not to use a scraping or scooping motion here. Collection tubes contain certain additives specific to the test or tests for which they are designed. You will need to ensure that the collection tube is filled to the right level to enable a mix of blood and additive. Under or overfilling the tube can also lead to inaccurate test results. It is important to gently mix the blood and the additive well. To aid this process, it may be helpful to gently rotate or swirl the tube after each drop of blood is collected. Once you have collected the necessary amount of blood, you should carefully invert the tube 5 to 10 times to ensure that specimen and additive are well combined. Do not shake the tube, as this causes hemolysis. Failure to mix well immediately after collection, or under or overfilling the tube, can lead to specimen rejection and test result errors. Refer to your institutional guidelines for the test you are conducting for information on storage time and temperature of the capillary collection container. The general recommendation is to analyze the capillary collection container promptly. Sample with confidence with the Unistik range of single-use safety lancets and sample right first time.